Good afternoon, everyone. It's so nice to see you all here. We're really excited to welcome you to our division's MSOT Research Poster Day. I'm Nancy Bagatelle. I'm the division director here and one of the co-instructors of this course, along with Kiara Peak and Lynn Wakeford. So again, we're very excited. This is really a culmination of a lot of work our students have been doing over the course of the past year, interspersed with field work and other coursework. So it's been quite an endeavor. We, a couple years ago, decided to change how we do our research with our master's students and to emphasize more of a team approach. And so we do this research in groups, and this year's groups of 6 or 7 per group. And the topics that are decided on are really match our division's research agenda, our scholarship plan for our work for the year. And as you probably know, many of you are aware that one of our key goals is about diversity, equity, and inclusion. And so we are drawing this year on a topic. Let me see if I can get this to advance. Our research theme, or the topic for the year, is understanding paths to occupational therapy for minoritized occupational therapists. I think everybody is aware that we have tremendous health disparities in our country, and part of that is attributed to some degree, the lack of diversity of our practitioners. And that includes OT, that is a largely over 80% white and female. And so a number of years ago, Lynn Wakeford and Kalia Johnson and Kiara Peak and Brianna Caldwell were involved in a project looking at paths to occupational therapy for Black women. And we decided that we wanted to continue to look at that and to think about other groups that are also minoritized in occupational therapy. So the purpose of the project this year is to explore the experiences of occupational therapists who identify as Hispanic or Latinx, LGBTQIA+, and disabled or having a disability. And we're looking at their discovery and exploration of the profession and during their educational program. So you may note that I have multiple terms, and that's something that I'm sure the groups will address, but each participant wanted to be identified in their own particular way. So we will be probably having some conversation around that as well. And so each group today will have 15 minutes to present their work, and then we'll have a 15-minute time for discussion. So we have discussants actually assigned to each to ask questions, but we want to open it up and ensure that our students in the first year and other people in the audience have a chance to ask questions as well. And the reason we're using this format is because we really want to have dialogue. We want to talk about the findings and the implications. So that's how we're going to address it. And
so hi everybody. We like to say, I'm LB. This is Francie, Sarah, Emily, Jordan, Madison, and Khalil. And today we are presenting on understanding Latinx practitioners' path to occupational therapy. We would like to note that in our study, we are using the term Latinx to describe our population. Though this is a relatively new term used to kind of coin inclusion for this population, not all participants identified as this. In fact, and some of our older participants kind of resisted the term Latinx, while some of the younger participants kind of have adapted the term to explain everyone as in a group. One participant who resisted had kind of felt like the term was developed by white people, which kind of opens up that mentality to, okay, where did this term come from? And then other studies have shown that while some members of the community appreciate that it is an attempt to be more inclusive, others view it not as meaningful to their identity. We asked each participant to self-identify, and they gave us a bunch of different responses, all the way from Latina, Latino, Latine, even Afro-Latina, and even Ecuadorian. And based on these inquiries, we kind of like did the different colors, which is the reason why we have blue, red, yellow. So this is kind of represents the different colors from each of the different backgrounds flags. So without further ado, we want to note that we do respect everyone's preferences. After further discussion, we did come to a consensus that for the purpose of our study and for the rest of this presentation, we'll be referring to our population as Latinx. So going into the intro, this is a diagram to annotate the race and ethnicity percentage in the OT field. As you can see, the blue is primarily white, and then our population is going to be primarily in the yellow, which covers about 5%. Disclaimer, it's labeled as Hispanic. This is from the census in 2019 because Latinx had not yet been coined by the government to describe the population that we are describing. But the majority of our participants would be in this 5%. We did have a couple of different ones identify as white, and like we mentioned, one as Afro Latino, so they might be in the blue or red, but majority would be in the yellow. So as you can see, they make up only 5% of the OT population, which is an issue when it comes to the diversity in the healthcare field. We found some literature that to support some of these barriers. In one article by Florendez et al. In 2020 stated that Latinx patients who are seen by healthcare providers of non-Latinx ethnicity creates the potential for cultural misunderstanding and conflict when behaviors are misinterpreted. And this kind of highlights the idea that when Latinx clients come in and they don't see people that either identify as them or seen by people that even speak the same language as them, different things like it mentioned, behaviors can be misinterpreted, communication can often be neglected, and trust can often be a difficult thing to share, which is the reason why it is very important to have diversity in the healthcare field. Other literature highlighted that, and this article by Kolelani et al. In 2020 highlighted that lack of exposure to OT affects career pathways through college years. And this kind of highlights the idea that a lot of our participants didn't really know about OT until later in their career, in their college career, or even after they were like exposed to the healthcare field, which is also poses disparity because if we're talking about bringing in different people of different backgrounds, you would want the OT field to be exposed much earlier so that they can come to a decision while they're going through their college career. So we also identified in literature that gaps exist in the current literature about what exposure and interest into OT school and the OT profession looks like specifically for Latinx individuals, which creates our purpose is to explore the experience of Latinx OTs as they came to learn about, choose, and pursue a career in OT. So going a little in about our method, we did a qualitative descriptive study with semi-structured interviews. We interviewed about 13 participants, 2 which identified as male and 11 who identified as females with an age range around 26 to 50, with the majority of participants being 30 or older. Again, some of the terms participants identified as were Hispanic, Latino, Latina, Latinx, and Hispanic. And then after interviewing, after scrubbing, hours of scrubbing and creating themes and having some deep group discussion, we created several themes that coincided across all of our interviews.
All right, so starting with our first theme of experiences and exposures, we defined this theme as differing pathways and timelines, all leading to OT. So what we found was that participants all had different ways of coming into OT. The people that had an early interest or knew that they wanted to come into healthcare were more focused on medicine, nursing, physical therapy, and most of that was because their families had either received those services, they themselves had received those services, so they were kind of introduced into those careers early on. For those folks, they were also very influenced by their parents for the quote unquote job security of healthcare jobs, as well as the monetary gain that comes along with being a doctor or being a nurse. For folks who joined the workforce before they decided to go into graduate school, we found that there was one person in particular, she joined the military before getting introduced into OT. And so for our representative quotes, we have OT just kind of showed up in my life And this was it. So with that quote, that's connected to a specific participant who was learning more about PT. And as they were doing their observation hours or whatnot, they noticed what OT was and got to see what OTs get to do. And so they found that that was the fit for them. On the contrary, we have another quote that states, "Everything happens for a reason." And so that kind of showcases the complexity of participants who kind of had different ups and downs, highs and lows during their journey into the workforce and then finding out about OT. So moving on to self-advocacy, we define this theme as participants taking the initiative to research, plan, and pursue OT degrees while advocating for their needs and worth in the field. So we found that the majority of our participants, as might be true for all of us, is they were the ones that were doing the research for themselves and finding out things about what OT is, where to go to school, financial resources, things like that. And so they were, as their theme says, they were advocating for themselves in that process. Research also came from just Google searches as well as AOTA. We had a couple participants who knew about AOTA early on, and they just dove right into those documents. Our quote, "No matter the cost," highlights the intensity that participants were invested in OT. So we had individuals who just spent countless hours researching. We had families who didn't know anything about loans or like financial aid, but just said, "Sign me up," all in the pursuit of this dream for their child or whoever may be. So furthermore, we found that determination and motivation also played an important role in participants self-advocating for their worth and place once they were in the actual OT program. So we saw participants really using those characteristics throughout their path in the program. We also found that this theme really emphasizes, and we wanted to emphasize this specific willpower and motivation, determination, resourcefulness for this specific theme that we saw throughout all of our participants in their journey to OT and afterwards. Then we have support. So support is defined as encouraging relationships and opportunities throughout the journey of pursuing an OT degree. So as I kind of mentioned a little bit early on, we had parents, peers, partners, friends who were very encouraging of our participants in their journey to finding OT and as they went through their programs. We found that strong emotional support was key to participant success as they experienced the stressors, as we all know, of graduate school, as well as when there were moments of self-doubt or just not feeling like they were in the right place. We also found that the importance of minority staff presence was key. So as our quote says, minority faculty provided a safe space. So we found that faculty with similar backgrounds or maybe who identified the same way that our participants did provide that safe space for these students, as they could share similar experiences and a similar background and could get better guidance as to financial aid or things like that. Lastly, we have financial opportunities in the form of scholarships were also key to success for our participants. One participant said the scholarships were the deciding factor. So that specific scholarship for that person checked that box and they decided to go with that program. Lastly, we have representation. And so we defined representation as differentiating between valuing the voices and experiences of diverse students versus using these students to give the public an appearance of racial diversity. Representation also refers to students being motivated to enter a career field where their perspective is underrepresented. So as you can tell from that lengthy definition, it took us a long time to kind of narrow it down and really figure out this theme because it was just complex for both our participants and for ourselves. So we had multiple participants who decided to come into OT because they wanted to be the people who provided those services to the folks in the community that looked like them. So that was a huge motivating factor, as well as participants also found that with that huge responsibility came feelings of tokenism. They felt isolated They also felt like they were responsible for teaching their peers, their classmates, and also their faculty about the experiences of a Latinx person. Also, other participants also felt their identities were put into a box, as our quote says. This particular participant is biracial, so she is a white woman with her mother was from Cuba. And so this person felt like she wasn't Latin enough for what she perceived her faculty's expectations were. It was an interesting interview where she explained that experience of talking to a faculty member and the faculty member asking, like, what are your experiences as a Latinx person? And it was an uncomfortable situation for her. We also have participants advocating for other minorities, other students of colors in the form of clubs or just general advocacy work within their cohorts. And lastly, we found that truthful representation of diversity within faculty and the student body was key to having participants join certain programs over others. We have one participant who toured a campus and a student of color was giving that tour, but when she sat in on a class, she found that that was the only person of color in the entire cohort. And so she kind of felt like that was a bit deceiving, for lack of words.
Okay, and to discuss our themes a little bit further, our first theme was experiences and exposures, and we found that there were a variety of ways in which our Latinx participants came to the career, but we noted that when the entry was later, there was increased stress and increased difficulty in the application process. For our next theme, we know of self-advocacy, we noted that many students had difficulty with the application process. They spent excessive time and energy trying to understand the requirements in the process, requiring them to take self-initiative. We interpreted this as perseverance in the form of sourcing information as a form of self-advocacy. For our next theme of support, we interpreted this as encouraging relationships and opportunities. Participants noted many forms of support as they came to the program. They noted forms of support from their family, from peers, and from faculty as being primary to their decision to accept and attend a program. Additionally, they cited financial aid and the kinds and the types of financial aid available as important to their decision. And last, navigating representation. We heard from participants about the ideas of being and seeing themselves in their educational programs, the faculty in the field of the OT, and they said both positive and negative aspects of this. We recognize that for participants, representation was not an easy load to carry and that it was a multifaceted experience. So what can be done to make the field more welcoming? We have 5 general areas of representation, recommendations. So first, reaching out to Latinx students earlier in their career. Second, making curriculum changes. 3, providing clear application requirements. 4, diversifying faculty. And 5th, increasing mentorship. Okay. Sorry, going fast. Our team recognizes that increasing Latinx student enrollment in OT programs is crucial to diversifying the field of OT. As our participants said, the single-digit Latinx percentage is a big issue. We must diversify the field of OT in order to provide high-quality healthcare to all and to address healthcare inequities that are exacerbated when providers do not understand and or value their clients' ethnicities, languages, and cultural backgrounds. Thank you.
If we huddle. I have had the pleasure for this last year of working with these wonderful research colleagues. And so I would like to introduce them before they get started. Alexis Jessup, Stephanie Berkowitz, Grace Ratu, Abigail McCoy, Carly Dean Reyes, and Taylor Jordan.
We are a diverse cohort in the sense of height. So good afternoon, everyone. As Nancy talked about earlier, our research focuses on the experiences of LGBTQIA+ practitioners through their experience to occupational therapy. For the purpose of our study, we will be using queer and LGBTQIA+ interchangeably. A lot of our participants had different identities when we asked on their demographic form. It ranged from transgender to bisexual, pansexual, queer, all the things. So we felt that these two terms really just encompassed all of those things. So as you know, there's a strong need for diversity so that therapists can kind of identify with their clients' lived experiences and understand them as occupational beings. By increasing this diversity, we can decrease health disparities and create more equitable outcomes. Currently, there are recruitment strategies for minority populations. This includes holistic admission, which looks at all the contextual factors that a person has and how it makes them one. Pipeline programs, which is an educational support program that it starts in middle school and goes all the way through college. And then we have mentoring, which is that direct support. However, when we were looking at the LGBTQIA+ community, this doesn't exactly translate to them because their identity isn't exactly visible and identifiable to the public. So this creates an ethical dilemma because queer identities aren't always obvious, and OTs must represent the populations they serve. So research suggests that the failure to recruit and maintain queer therapists into the profession has the potential to hinder the advancement of not only practice, but education, research, and policy. And for OT to continue to move towards an inclusive field, there needs to be greater attention and understanding given to the queer community and their specific needs. So thinking about this, the aim of our study was to understand the supports and barriers that queer practitioners experience on their journey to becoming an occupational therapist.
Our research utilized a qualitative, descriptive approach, and our participants were queer practitioners who self-identified as members of the LGBTQIA+ community. Other inclusion criteria for our study included being credentialed practicing occupational therapists working at least 10 hours a week and having had received their professional education in the United States. 13 participants were initially recruited for our study, with 9 participants completing interviews. Participants' ages range from between 24 to 49 years old, with an average age of 34 years old. We had 8 participants who self-identified as white and 1 participant who self-identified as white Latino. 7 of our participants entered the field with masters, and 2 of our participants entered the field with entry-level doctorate degrees. We had a wide range of experiences among our participants. Participants' experience in the field ranged from 7 months to 10 years, with an average of 4.4 years of experience. Our participants also held a variety of sexual orientations and gender identities, ranging from trans, non-binary, queer, bisexual, gay, and lesbian. So our data utilized our data was gathered using semi-structured Zoom interviews. And interview topics included career exploration, decision-making, selection of an occupational therapy program, as well as entry into the field. And this included both barriers and supports that were present along the way. Our interviews, again, were conducted on Zoom and lasted approximately 60 minutes. Audio was recorded and transcripts were gathered using Zoom software. After our interviews were conducted, researchers then cleaned the transcripts in order to better convey the messages that our participants had expressed during our interviews. These clean transcripts were then utilized to conduct a qualitative analysis based on the processes identified by Braun and Clark in 2006. This process included manual coding for themes and sub-themes. We first coded our research in smaller groups before triangulating our data sets, and we discovered 4 main themes throughout our research. These themes being exclusion, coming out, belonging, and self-preservation. Our first theme, exclusion, was prevalent throughout all of our interviews that we conducted. Participants expressed numerous ways in which they were affected by exclusion, ranging from subtle microaggressions to more blatant acts of discrimination. For instance, one of our participants stated, "I was just wondering if they were meeting like a diversity quota or something when discussing their acceptance into occupational therapy school." So for participants whose programs lacked representation, they were responsible for shouldering the burdens of the microaggressions they were facing. They had to educate their peers, educate their professors, and served as a token member of their minoritized group. Apprehension about being the token queer among their cohort was then realized by the stereotyping that these participants faced. For instance, participants discussed being expected to know everything about the LGBTQIA+ community and having the same experiences as anyone else within the community, which then furthered their feelings of exclusion from the rest of their cohort. The tokenism that they experienced had a significant impact on their feelings of acceptance within their program. Many participants felt that their acceptance into occupational therapy school had just been used to fill some perfunctory diversity quota as opposed to being based on their individual achievements and unique identities, which then led to feelings of self-doubt. Coming out was another theme prevalent throughout our research. It entailed self-discovery, exploration, and was influenced by the timing in the individual's lives. Other factors that influenced how and when a participant chose to come out included an inclusive culture at their university, the cognitive load of managing both personal and school responsibilities, and perceived emotional and physical safety in their spaces. The decision whether or not to come out and self-disclose their identities was also influenced by the timing in their lives, their geographic locations, support within leadership positions, and belonging within their cohort. One quote that stood out from our participants related to this theme was, "It was more complicated than just gender. There's a level of disclosure of in what spaces I can be what level of honest with people about things," when referring to their identities.
Get down just a little bit. Now going on to our theme of belonging. This was mentioned by a lot of our participants, but the degree to which they felt that belonging varied. There are some sources to belonging, including social support, representation, recognition and inclusion, and role models. Social support for our participants were family and friends, whether they be inside their program or outside their program, who helped them motivate on their OT journey, whether it's in programs, field work, and so on, and gave them the emotional support or financial support that is often needed in a rigorous graduate academic program. Representation was the extent to which participants felt that the LGBTQIA community was present and visible within their program. So one participant talked about seeing faculty who were part of the community, and they said, quote, "They were just both like out and open with who they were, unabashedly unashamed." And I was just like, how refreshing. Continuing on, this offered them support, offered them comfort with their identity that they had previously not had. Going on to recognition and inclusion, this was crucial for them to feel belonged and lessening the burden of having to educate their peers and their people in power higher up. But unfortunately, not as many participants said that there were professors, clinical instructors, their peers who were overt in their acknowledgement of the community or inclusion of the community. And then last, role models, which we identified as the presence and visibility of queer individuals, but their success within the profession. And then next, self-preservation. The need for self-preservation was a source of anxiety for a lot of our participants. We identified sub-themes within this theme, including gender expression, passing privilege, power dynamics, and assessment of others. One participant gave us a really good quote for just how much this was at the forefront of their mind: self-preservation over everything. Gender expression, we define as weighing the pros and cons of how to make yourself and how you make yourself appear to others based on the heteronormative ideals. And then passing privilege, kind of connected, was how well you fit into those ideals. And those concerned with passing often concealed what they thought were pivotal parts of who they were. Regarding power dynamics, we define this as a position's sense of self within this power dynamic. So how much could that negatively impact their identity? Fieldwork was the most commonly identified as where they felt particularly vulnerable to potential negative experiences. Which relates to assessment of others. So evaluating aspects of another person to gauge the acceptance. So aspects could be their religious affiliation, political views, or just how they showed their appearance. So many of our participants use external identifiers of others to gauge whether or not they felt safe to disclose who they were and their identity.
And back up. So moving on to our discussion. There were several commonalities found amongst our participants and that of their cisgender and heterosexual peers. Some of these commonalities included variation in how and when they came to discover the field of OT and how they went about pursuing the field. In addition, a primary stressor for both populations included the financial burden of having to pay for their education, which was further exacerbated by the student's inability to work due to the time constraints associated with attending an OT program. Despite these challenges, many of our participants described OT as being the right fit for them and decided to move forward in pursuing the career path. Upon moving forward, participants also expressed a desire for belonging within the OT community. Differences for our participants occurred in how they were or were not able to find that sense of belonging within their OT programs. Unlike their cisgender and heterosexual peers, our participants described experiences of tokenism, microaggressions, self-doubt, and the burden of educating others as active barriers to their inclusion within the OT community. Consequently, participants enacted several forms of self-preservation to minimize exclusion and enhance their feelings of safety within their programs. Participants identified social support, recognition and inclusion, representation, and role models as factors that increase their sense of belonging and support within their communities. Our study reveals several implications for the OT field. Firstly, media representations of OT need to be inclusive of diverse OT practitioners and educators. Materials introducing OT as a career should be developed for school-aged children and should represent diverse practitioners and perspectives. Lastly, educational programs should make an active, intentional, and visible effort to implement structures and resources that support queer OT students. This might include having queer individuals in positions of authority, such as on staff or as in AOTA representative positions, having overt signs of inclusion in the environment, embedding queer-related topics into the curriculum, and connecting students with resources that support and promote their queer identities. Our study conveys that there is no single queer experience. The queer community is a multifaceted population comprised of many intersectional identities whose experiences are further compounded by existing aids and constraints available to them in a given setting. The experiences of our study's participants vary greatly depending on the supports and barriers available to them within their programs and demonstrate the need to increase the support available to queer students pursuing a degree in OT to recruit and retain a more diverse population of OT practitioners. We hope that this research prompts OT programs to educate themselves on queer issues and allyship in order to create a more inclusive environment for both faculty and staff. Thank you for listening.
Get started for our last group. So I've had the pleasure of working with Kirsten Brown, Lacey Cronister, Lauren Winnick, who's behind me, Skylar Wheeler, Dan Rosenbaum, and Marissa Barber, and Faith Best, who is on her honeymoon. But she was an important part of this group. We've had a lot of fun and interesting conversations, and so I will turn it over to Skylar.
Good afternoon, everyone. Our team's research focused on understanding practitioners with disabilities' path to occupational therapy. The field of OT recognizes the importance of diversity, equity, and inclusion, and a major goal within the field is to increase the diversity of licensed practitioners, which will work to expand the field in a larger range of settings and communities, and clients will also benefit from working with practitioners from diverse backgrounds. However, prior literature on diversity focused on gender, ethnicity, and race, and lacked the view of practitioners with disabilities. It's outdated and is mostly conducted outside of the United States. Therefore, our research aimed to close this gap and explore the experiences of practitioners with disabilities in the United States. To gain more clarity on the path of practitioners with disabilities, we formulated 2 research questions. First, how do individuals with disabilities find out about, choose, and pursue a career as an occupational therapist? And secondly, what supports and barriers do they experience in this process?
In pursuit of the research question, we opted to use a descriptive qualitative design that allowed for flexible data collection and provided a broad range of topics. The research team recruited participants with flyers, email, word of mouth, and social media posts. OT organizations included groups focused on disability and diversity were included. Participants were required to identify as having at least one disability, have previous experience as a practitioner, and having had received their professional education in the United States. 10 participants were ultimately recruited between the ages 25 and 59 years old, a majority of whom identified as white females. Reported disabilities included sensory impairment, neurological disorders like cerebral palsy and SCI and brain injury, congenital amputation, and mental health diagnoses, including anxiety, depression, and PTSD. Semi-structured interviews lasting approximately 60 minutes were conducted via Zoom. These interviews aimed to explore the experiences of participants and the meanings they attribute these experiences. The research team utilized thematic analysis to identify, analyze, and organize consistent patterns across the data that describe discovery and pursuit of OT with subsequent supports and barriers. The research team broke into groups to code the data over several sessions. The codes were organized into clusters which represented emergent themes from their experiences. The 4 main themes were named using in vivo quotes from participants.
So before we dive into our findings, we just want to add that we will be using both person first and disability first language, as participants had varying views about which language they preferred. In addition, we will be using the terms invisible and visible in regards to how we refer to varying types of disabilities. However, we want to note that not all participants identify with just one term. So moving into our findings, the first theme that emerged, let's see if this works. Help me out, man. OT found me. Thank you. This theme explores entry into OT. We found that some participants reporting having an original interest in other healthcare fields, but felt that those fields lacked the necessary accommodations and inclusivity to succeed. For example, one participant pursued a different healthcare field and was met with a lot of barriers and shared that a career was literally taken from them because of their disability. Despite these experiences, participants still had a drive to help others and found themselves drawn to OT due to its holistic perspective. This resulted in many participants shadowing occupational therapists, conducting their own personal research, and taking pre-OT classes to explore and learn about what the field of OT had to offer. People ultimately chose to pursue OT because they were drawn to the inclusivity and holistic nature of the field. However, others felt that OT always felt like the natural choice and pursued it with intention. The next theme that emerged was my disability painted every experience that I had. This theme highlights how disability experience, stigma, self-acceptance, and growth transact. Beginning with disability experience, participants often identify their disability as an asset that taught them adaptability. One participant in particular noted that I have a lifetime of experience adapting the environment when the environment couldn't adapt to me. In addition, lived experiences being a patient helped them connect with clients on a deeper level and to the importance of holism. For example, one participant stated that learning about the holistic approach makes you understand yourself as a person with a disability instead of a disabled person. Others echoed how empowering this perspective was. However, participants experienced stigma on their path to becoming an OT, which did cause internal turmoil. Specifically, participants with invisible disabilities had to choose whether or not to disclose their disability. When participants chose not to disclose, hiding or suppressing the challenges they were facing often amplified any feelings of discomfort that they had. For instance, one particular participant chose not to disclose their disability throughout the application process, stating, "I was doing anything I could just to prolong the inevitable revelation." However, the process of reaching self-acceptance of one's disability was transformative. For example, one participant reflected on their own process, stating, "In order to be happy, I needed to find that identity. It wasn't an option. It was either be unhappy or figure out a way to embrace it." Finally, participants also experienced growth in learning how to become self-advocates. One participant noted, "I had to learn how to be a lawyer. You have to know your rights as a person with a disability, otherwise you'll get taken advantage of." Overall, whether participants had positive or negative experiences associated with their disability identity, growth occurred on their journey to becoming an OT.
Okay, so our third theme was, I just would hope that every school would be accommodating. Participants for our study consistently reported that they sought out OT programs that they believed would be welcoming and supportive of them as students with disabilities. Many sought out programs that they felt would meet their specific needs, and they applied to those schools, and some reflected that they were satisfied with their choice. One person explained, "I don't think my disability influenced where I decided to go because I just would hope that every school would be accommodating," which is the name of this theme. In hindsight, participants were mixed on whether their experiences ultimately matched their expectations. One participant noted, "Some of the professors would have this pre-programmed idea about what you needed to be in order to be successful in a certain fieldwork setting, as opposed to how can we make the setting fit the student. Barriers to certain fieldwork settings and tedious processes for securing accommodations created, in their words, one of the first times in my life that I can recall that my disability had really stopped me from doing something that I wanted to do." Another participant told a story about a time that the university wanted a doctor's note to prove that they actually had a disability that was plainly visible. And the note was not secured in time, but then the program just waived the requirement anyways, and they allowed for the accommodation. And so the person got the accommodation, but they were left really frustrated and sort of less likely, they said, to pursue it in the future. Students frequently had to advocate for their needs in order to succeed, and this sometimes came with costs. One person explained, "Sometimes advocating comes with people wanting to get rid of you," suggesting that they at times regretted their efforts. And these participants' experiences with discrimination and biases led them to question whether OT was actually not a fit for someone like them. Our fourth and final theme is, it just takes one person. Many participants reported having meaningful supportive relationships, while others had people in their lives who had discouraged them from pursuing OT as a career. Our findings suggest that having at least one significant relationship can impact individuals both before and during OT school, and it can go both ways, both positive and negative. Positive connections made significant impacts. Several people expressed having had nurturing mentors or advisors during the graduate school that really helped them maintain their motivation to finish school. However, some participants also reported that they had had unsupportive relationships, and that was really discouraging. One person said, "I talked to my parents about it, and my mom said no, that I wasn't smart enough for it, that I should be a CNA instead." This type of discouragement created emotional turmoil regarding whether the decision to pursue OT was correct. But positive or negative, despite the quality of their relationships, all of our participants ended up completing their programs and became practicing OTs.
So moving on to the discussion. Our findings support prior research that highlights the importance of early exposure to the field, as well as challenges and barriers that people with disabilities encounter on the path to becoming an OT. The data has overwhelmingly shown that these students with disabilities experience a range of supports and barriers both before and during OT school. While some participants felt comfortable disclosing their disabilities and were able to require accommodations, other participants masked their disabilities and struggled to procure appropriate accommodations. This added a layer of complexity within their academic careers and limited fieldwork opportunities. Further, another significant finding was the importance of relationships, including mentors and exposure to OTs with disabilities, both of which have positive influences on the participants' experience. Overall, access to accommodations, choices to disclose, and relationships transact to create complex, multifaceted situations for students with disabilities in OT school. Given that our findings largely mirror research conducted over 20 years ago, it's clear that OT as a field needs to continue examining our inclusivity, recruitment techniques, and the implementation of accessible accommodations, both in the classroom and during fieldwork. Our findings have the following implications for OT programs. First, we must promote earlier exposure through recruitment programs such as career fairs. Next, we must consider hiring a disability coordinator and developing mentorship programs. Third, we must continuously examine the inclusivity of our curriculum and teaching practices. And finally, we must require continued education for OT faculty and fieldwork educators to reduce ableism.
Overall, our findings highlight the importance of inclusive environments and attitudes, as well as access to accommodations and occupational therapy education programs for individuals with disabilities. With increased exposure, changes in curriculum, and continued education for OT educators, the path to OT for individuals with disabilities can become more accessible, making increased diversity in the field a reality and not merely a rhetoric.